Podcasting from St. Louis, Missouri, this is Functional Wellness with Dr. Allison, your information and inspiration hub for all things health, wellness, and functional medicine. Your host, Dr. Alison DiBarto Goggin, has been practicing functional medicine for over 11 years. She is passionate about finding root causes and solutions for gut health, hormone balance, anxiety, and autoimmune conditions. Welcome to the show.
Welcome. Today we are talking about dealing with belly fat. Are you tired of dealing with it all around your belly? Your midsection never seems to go away, kind of only seems to get worse over time, right? So today we're talking about why you might be carrying the weight there, how to help your body feel its best too. I am hosting a free class on how to lose belly fat with nutrition and essential oils this month. So you can join us for free. It's in our Facebook group on October 19th. I will be live, but the class will be recorded. So just follow the link in the description. And if we haven't met yet, I am Dr. Alison DiBarto Goggin. I am a functional medicine physician and a doTERRA wellness advocate. I help people overcome chronic health issues so they can feel like themselves again. So a few years ago, I was working with this woman who was about 55 at the time. She's postmenopausal, which is a big key for what we're going to be talking about today. And she found each year she was just gaining more and more weight. And of course, it was staying around her midsection. Her pants couldn't button anymore. She was embarrassed, like no exercise routine was helping. She had tried keto and fasting, and that wasn't working either. So what we had to do is first get her blood work done, check everything that was going on, do her initial consultation, and we really found that her body was struggling with hormones and adrenal fatigue. I honestly hate to use the term adrenal fatigue all of the time, but that's what she was going through. Hormone imbalances, as well as pre-diabetes. So it took a few weeks because nothing's overnight, right? But once we got her blood sugar balanced throughout the day, her hormones working correctly, her adrenals able to take over for these menopause hormones that we still need, we were able to say goodbye to her menopause symptoms. Her body started to release the weight. She wasn't so swollen and inflamed all the time. And that is just so amazing and important and really just freeing, right? Because she could be herself again. So let's be specific. Like, what is belly fat, right? It's the fat that accumulates under your skin and kind of gives you that keg belly. You might feel like you look like you're pregnant. Visceral fat is fat that accumulates around your organs. And both of these types of fat can be very dangerous to your health. It's linked to increased risk for heart disease, diabetes, high blood pressure, and even lung issues, as well as it's incredibly uncomfortable. You can't do the things that you want to do, like bend over and tie your shoes or go up and down stairs. So while we look at belly fat, and most people come to me and just say, I want to look better, it's really about helping your whole body feel better and reducing this risk for long-term issues. We're going to talk about men and women separately. Men will be at the end because they're just the easiest to deal with. Women are so much more complicated and hold on to weight in their midsections for so many more reasons. This includes scar tissue from C-sections, from surgeries, from endometriosis, from gut issues like Crohn's or colitis or celiac disease. All of these things can cause inflammation, accumulate fat, and really just give the body some problems. So that's one issue. Hormone issues with cortisol in the adrenals, because high cortisol will cause your body to hold on to more belly fat. It's just where it goes. You can look up and Google like body fat, body types, and each one has kind of a different system and a different message of what your body's saying. Stress, trauma, insomnia, overtraining, overexertion, running yourself crazy on both ends are the most common causes of high cortisol, especially if you find out that the more you work out and the harder you push, the fatter you get. This is a sign that your cortisol is off. One way that we test for that is to look at your basic blood work. We can tell that through, tell you have adrenal issues through your basic blood work, as well as an adrenal saliva index. So you do a spit test and we track your cortisol throughout the day and the night. It gives us a lot of hormone information as well, because it might be too high in the morning, it might be too high at night. There's lots of different things that can happen. So getting that test can be really helpful and insightful. And then the next most common reason is female hormone issues. So estrogen can cause us to hold on to a lot of belly fat. And so when I say a lot, I mean excessive, where maybe like you can rest your hands on it, like Santa. It's a little extra place for your plate to go. So when we go through menopause, the ovaries stop making hormones and the adrenal glands take over, meaning they have to do even more work. So the adrenal fatigue means that the adrenals are just overwhelmed. They can't keep up with the work. They can't keep making stress hormones and norepinephrine and epinephrine. And now they have to make estrogen and progesterone, testosterone, and they kind of just fall apart, right? And this can look like a lot of weight gain. It can look like menopause symptoms with hot flashes, vaginal dryness, painful breasts, insomnia, all of these things, because the body just can't make the right levels of hormones. So let's talk about how do we reduce the belly fat, knowing that we have a lot of these major factors. It's not just one thing, right? So of course, number one is getting your blood work done, getting these hormone tests done, whether you do saliva or the Dutch or blood work, and making sure that your adrenals are happy, that your ovaries are happy, and see where your levels are now, and then retest in 6 months and make sure that you're on the right path. Reducing stress, meditating, and getting more sleep will be the most important. All of these things are important, but it was going to help you feel better, obviously, and help balance out these hormones and your blood sugar as well. The other thing you need to do is stop overtraining or overexerting yourself. So this includes, of course, exercise or home life or work life, or if you're up at 4 a.m. to take care of the kids and the dogs and yourself, and then do all the running around, and then you go to work yourself, and then you pick the kids up and you're going to sports and practices and games, and then you have to come home and make dinner, and then you have to clean, and then it's 1 o'clock in the morning, you're finally in bed, but you got to be up at 4. That's overexertion. That's overtraining. How can you delegate? How can you cut back? How can you get more help? Who can you either ask or hire and take some of the load off of you, because it's too much and you're making yourself sick. All right. I know that's a big one, and nobody likes to talk about that because it's like too easy and it's too hard. All right. Cut out alcohol and cigarettes. Both of these are a sugar bomb in your body. There's so many reasons to cut out alcohol and cigarettes, but if you're struggling with belly fat and you want to lose weight, you want to feel good in your body, you want to get rid of the inflammation, cutting out alcohol and cigarettes is key. I did a great cigarette podcast, and the biggest thing that I hope you take away from that is when you smoke a cigarette, the nicotine will raise your blood sugar levels, which causes prediabetes, insulin resistance, and keeps the belly weight on. It keeps weight on your whole body. So if you want to beat diabetes or prevent it, you have to stop smoking. And the same goes for alcohol. When we have fatty liver or your liver becomes congested, it can affect our hormones, and it also piles on the weight on our belly. And then most likely, when it comes to food, probably benefit from a keto style eating with higher fat and lower carbs. I like to see people eat about under 40 grams of carbs on this style of eating as they are changing their physiology. And this might mean that you don't have to do the diet forever. This might not be a life sentence for you. If you could stick to it and get your fat reduction down, improve your health, reduce your risk of serious disease, and then you can go back to a more balanced way of eating if that's what you prefer. It just really depends on how quickly your body responds, how serious your underlying issues are, how many underlying issues you have or comorbidities. That's going to define how you eat, how long you have to eat a certain way until your body starts to heal. Mild exercise is great, again, because we want to avoid that overtraining. So don't exercise 2 times a day. Don't exercise for 2 hours a day. If you're exercising and you get really tired afterwards, you're doing the wrong workout. Okay. I love walking, weightlifting, something that gets your body moving. It has to be for more than 20 minutes a day in a consecutive amount of time. So you can't do like, oh, I did 5 minutes here and then I walked out and got the mail. That doesn't count. You need your heart rate elevated for at least 20 minutes a day. The longer, the better, but I would say my max would be like 40 minutes, especially if you're struggling with hormone imbalance for men and women. Let's talk about supplements. So my favorite supplements and herbal support include berberine, cinnamon, and gymnema. So those are for blood sugar support. And then we could do adaptogens like rhodiola, ashwagandha, and omegas for adrenal support. And then I use oils like lavender, rosemary, copaiba, and cypress for adrenal support, hormone support as well. So you can take supplements, but this is my warning. There is no miracle cure. There's nothing that's going to melt away fat. You see it all the time on social media and Google ads and like everywhere, like melt the fat away, just take the string, 2 tablespoons a day. And that's great. For some people that works. For people who have no underlying health conditions, who have a great body anyways, of course it's going to work. If you have hormone concerns and adrenal fatigue and menopausal symptoms and andropause, it's not going to do the job. So don't fall prey to going out and buying 100 different supplements or spending a ton of money on one supplement thinking it's going to cure your belly fat, because we have to dig so much deeper into your physiology to see what's going on. And you have to be very consistent. You cannot eat healthy for one day and be like, I lost 20 pounds. This is something where you have to be consistent every single day for a good amount of time. So I know that sounds frustrating, but it also is kind of a release. Like, it's not going to happen overnight. You can do this. You can take care of yourself. All right, let's talk about men, because I don't have as many hormone issues as women do. Their hormones aren't changing every day. For men, the belly fat is definitely linked to blood sugar levels, alcohol intake, diabetes, fatty liver disease, and andropause. So andropause is kind of like menopause, but where the body just starts slowing down. It has a harder time regulating testosterone and cortisol. It has a harder time regulating blood sugar. And for men, technically, it's a lot easier to lose weight in the midsection. They're just really lucky with that. The best strategies for them include reducing their carb intake to at least under 100 grams if you're not doing keto, to help reduce the sugar levels, balancing that as well. Supporting the adrenals and the brain and the testes can be important. We do that with glandular work, with supplements, very easy. And then walking and weightlifting. Weightlifting will dramatically improve testosterone, which will dramatically improve the rest of their body. So lifting weights is key. Walking, getting your heart rate up, cutting out the alcohol and cigarettes, and they tend to do really, really well. I also see men do really well on Optavia as well. It's something I offer some of my patients. And so it's just a great, simple way where all the food's already done for you. You don't have to prep anything. And then they lose weight relatively quickly in a healthy way. And that's really the key. So there's a lot of reasons why your body might be holding on to belly fat. And I hope that this kind of triggered that for you to figure out why it's happening, rather than just jumping into a diet or a nutritional protocol, because you might be focused on cutting calories, but the whole time you have this thyroid or adrenal issue or diabetes. So make sure that you really figure out what's going on before you just run around trying all these things. Of course, you can schedule a free health assessment call with me, schedule online. You can message me on Facebook so we can discuss, like, how are you feeling? What type of testing have you had? Do you need? What are your goals? And let's brainstorm on how to get you there. Make sure to join us for the Reducing Belly Fat class in a few weeks, or catch the recording. And as always, make sure you like and subscribe so you can stay tuned with all of our weekly podcasts and information. And I'll see you next time.
Thank you for listening to Functional Wellness with Dr. Alison. If you would like personalized care and testing, you can schedule a free introductory consult with Dr. Alison online at Little Black Bag Medicine, or message us on Facebook at Little Black Bag Medicine. Thanks for tuning in, and we'll see you next week.